So there's a few reasons that we're transitioning this. Global Ministries has had this plan and with the intention of taking the very best care of retired missionaries for decades. When they transitioned it over to us, we just wanted to evaluate it from the same lens that we had done with the other retiree health programs that we offered, like I said, to annual conferences and other agencies and such. This VIA benefits program is one that we've seen very, very popular and good success with other United Methodist entities. So one of the big reasons that we like it is that it's very flexible and for individuals to pick plans and have plans that really fit their personal financial and medical needs. And it also saves many people, it saves a lot of money. And that's always a good thing in retirement. It also helps us keep the plan sustainable and so that we can continue to provide it for the long term. So that's an important thing. And then this is a little bit less for this group and a little bit more for the international group, but I'm sure that you all care very much about your international fellow retired missionaries. But this plan will also allow us to offer greater parity between the US and the international retirees. And we think that's a really good thing. So what we are transitioning, and I hope that you saw this in your letter, is so we will give you all beginning in April of next year a health reimbursement account. And that health reimbursement account or arrangement, HRA, is money that that you can access. It's not like cash that you can just withdraw and transfer over to a different account. It's money that's designed to reimburse you for health expenses, and it will replace the medical, the pharmacy, the dental, the vision, and the Medicare Part B premium reimbursements that you get currently through Sterling or 90-degree benefits. So that money will be in a pot for you to be able to access. And this is, of course, the first time that you've seen these dollar amounts. So we have two classes of retirees just based on years of service, not how much you're loved and appreciated, but based on how long you served. So the class 2 retirees served longer. And so they're going to get $4,600 a year in the HRA. Now, since we're transferring in April, we're prorating that, right? So we're dividing it by, we're converting it to a 9-month amount, and that 9-month amount in 2023 will be $3,450. I will tell you how I got that number in case you're wondering. And then our class 1 retirees who have a little bit less service, but still substantial service, they will get $3,300 a year. And again, we prorate that because it's only 9 months in 2023. And so that'll be $2,475 from April to the end of 2023. I don't know if you're familiar, we also have a nursing home and independent living grant program that is part of this Collins Retiree Health Plan. That will continue similar to how it is today, only Wespath will administer the grant program instead of Sterling or 90-degree benefits. So that will be separate from your HRA amount. What will you do with this HRA? So you'll use it to reimburse yourself for anything related, any eligible health expense. It could be your Medicare Part B premiums. It could be like an amount that you'll pay to be on a Medicare supplement plan. And I'll talk about how you get on a Medicare supplement plan or a Medicare Advantage plan, or it could be for like your co-payments for seeing the doctor or being in the hospital or getting a medication. So you can use that HRA for all of those things. Way more detail will be provided later when you can actually take action. We just didn't want to spring it on you in January. We wanted to give you plenty of time to think and ask any questions that you may have. As I said, the transition will be effective April. So we still have about 6 months to go. Here's how I got the numbers. So again, our class 2 retirees are $4,600 a year. And the way that I got that is $2,600 represents the value of like the medical and pharmacy benefit that you currently have through the Sterling or 90-degree benefits plan. $1,600 a year replaces that Part B reimbursement. I took how much you get in 2022 and I grossed it up 5% for 2023. And then $400 a year to purchase a dental supplement. You could also purchase a vision supplement with it if you wanted. The calculations for the Class 1 retirees are very similar. So it's a little lower to kind of replace that medical and pharmacy benefit. And that's because that benefit is a little bit less value. It pays a little bit less for Class 1 retirees. And then you get reimbursed a little bit less if you're a Class 1 retiree for Part B also. And so that's how we got this number as well. Now, I do want to share that there will be also this catastrophic pharmacy HRA. So if you're familiar with how Medicare pharmacy plans work, there's that like donut hole, and then you get to a certain point and then you're in catastrophic, like you have catastrophic pharmacy expenses. If you get there and you've spent all your HRA, there will be another HRA available specifically for people who have what are considered catastrophic pharmacy expenses. So that's just a safety net that Wespath is putting in place to make sure that if you have a really bad year, that we're just providing an additional safety net and you're not spending a lot of your own money.